All right, moving on to chapter 5, emergency care on medical terminology. There we go. So, medical terminology. We're going to talk a little bit, of course, about medical terminology, but also the language of anatomy and physiology, and talk about some basic anatomical terms. And I think it's important for us to understand the language of medicine because initially, when you start taking EMS courses, the language of medicine is like learning a foreign language. But if we understand how these words are put together, sometimes that can help us understand the words themselves. And just always remember that if you don't know the big word or you don't know the big, long, lengthy medical word for what it is you're trying to describe, go ahead and use the words that you do know. Certainly, as an example, if in the discussion of a female patient with abdominal pain who may have had a hysterectomy, you don't need to note that she's had a salpingo-oophorectomy. That's a big word for for a hysterectomy, or what occurs when a woman has a hysterectomy. They remove her salping, which are her fallopian tubes, and her oofers, which are her ovaries. Using big medical terms is something that the more you use these medical words, the more comfortable you'll be with them. But if you don't know them, that's okay. Use the ones that use standard language to get your point across, because you'd hate to give the wrong word or the wrong meaning to another provider. That may send them down a different direction looking at something else. So the components of medical terms, compounds are made up of two or more words. So compounds are part of medical terms, like small and pox. Pox we know is a raised little red rash, and small would indicate its size. So compounds can be made up of two words. Words are also made up from parts like root. The root of the word is typically the meaning, and then you can combine with the root prefixes and suffixes. Prefixes come before the root word. Suffixes come after the root word. So the examples that they give you here is that therm is heat, and a meter we know would be something to measure something. So a thermometer or thermometer would be something to measure heat. When we look at prefixes, pnea is the root word for breath, and dis is difficulty, tachy is fast. So dyspnea would be difficulty breathing, and tachypnea would be rapid breathing. Suffixes added on to words change the word. Arthra actually is the word. Arthra refers to your joints, and itis is an inflammation. So any word that ends in itis refers to an inflammation. Arthritis would be an inflammation of the joints. Tachycardia, here's another word component example for you. Tachy refers to fast, cardia refers to heart, so tachycardia would be a fast heart rate. Hemo refers to blood, thorax refers to chest, so a hemothorax would be blood inside the chest. Here's three words put together. Cardio, referring to the heart. The ology, or logi, refers to the study of, and ist is somebody who specializes in something. So a cardiologist is somebody who specializes in the study of the heart. Acronyms are abbreviations that are made up of initials that can be pronounced as a word. So CPAP is a good acronym, and CPAP stands for Continuous Positive Airway Pressure. As an EMT, that is something that you can provide, as you'll learn later in the course. And so when you refer to CPAP, everybody knows you're talking about continuous positive airway pressure. DNR is another one, which means do not resuscitate. When and when not to use medical terms. You probably shouldn't use big medical terms when speaking to patients or family members because it may confuse them. And occasionally complex terms used in messages can cause confusion even among other trained healthcare professionals. And if there's a potential for ambiguity, do not be reluctant to return to simple terms. In other words, if you're not sure you're using the right medical word, then use the word that you know. Now, anatomy and physiology refers to the study of the body structure, which is anatomy, all the parts of the body, and physiology is how these body parts all work together. There are some directional terms that we use when describing a patient. The correct anatomic position is when a patient is facing you, their hands are at their sides, their palms are facing you as well. That is the correct anatomic position. From there, we can identify other planes and anatomical directions as well. The body is divided into planes. The body is divided down the center. That's known as the midline. So anything medial is closer to the center of the body. Anything lateral is farther away from the center of the body. Bilateral, bi meaning both, so both sides. Unilateral, one side. Mid-axillary, the mid-axillary line is the line that runs down the center of the armpit and would divide the body into a anterior and posterior half. Anterior is the front of the body when standing in the correct anatomic position. Posterior is the back, also known as dorsal. Superior is above, towards the head. Inferior is below, towards the feet. Proximal is closer to the torso. Distal is farther away from the torso. Palmar refers to the palm of the hand, and plantar refers to the sole of the foot. Plantar fasciitis, an inflammation of the fascia of the plantar muscle in the foot. So here are some of those directional terms. This is the correct anatomic position, the way this gentleman is standing. And from there we can see his cranium, which is his skull, his face, which is attached to the cranium, his mandible, which is his lower jaw, and then he's got his neck and his shoulders, his arm, upper arm, elbow, forearm, wrist and hand. The shoulder all the way to the fingers make up the upper extremity. The head is made of the cranium and face. The torso is the thorax and the abdomen, and arguably the pelvis. Lower extremities include the femur, which is the thigh, the knee, the lower leg, the ankle, and the foot makes up the lower extremity. There's that midline dividing the body in half, proximal towards the body, distal away from the body, medial towards the center midline, lateral away from the middle midline. Midclavicular is halfway across the clavicle, a straight line that you would draw down the chest, and we use midclavicular as a reference point for needle decompression. We use it as a reference point to listen to lung sounds as well. And here, standing at the patient's side, you can see the mid-axillary line dividing the patient into an anterior portion and a posterior portion, superior towards the head and inferior towards the feet. So those are more directional terms. Okay. Since there are two clavicles, there are two midclavicular lines, a left and right, and same would hold true for axillary. Now the body is divided into planes as well. You've got a sagittal plane, which is that midline. You've got a frontal plane. You've got a transverse plane as well. So these are the planes of the body, and we don't use these terms much at all. Radiology uses them more than we would. The abdomen is divided into quadrants, a midline and a line drawn across the umbilicus, horizontal to the ground, will divide the abdomen into 4 quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And the whole purpose of dividing the abdomen into quadrants is to help us identify perhaps if they have pain in the right upper quadrant, we know the appendix is there. If they have pain in the lower left quadrant, we know the spleen is there. Right upper quadrant, we know the liver's there. Left upper quadrant, we know the pancreas is there. So it gives us an idea of perhaps what may be hurting depending on the location of the pain. Now this is known as supine when a person is lying flat on their back, and this is prone when they're lying flat on their belly, and this is a lateral recumbent position, or what we commonly call the recovery position. This is a position that you would place a patient, maybe draw that top knee forward and lay it on the ground so they can't roll flat onto their belly. Semi-fowler is a position. There's also fowlers, semi-fowlers, high fowlers, and these are just different angles in which a person would be seated. That semi-fowler is about a 45-degree angle. There's a 30-degree angle. There's a 25-degree angle. There's a 90-degree angle. And it's not important to know the angles. It's important to know that some patients' position of comfort is different. Some may need to sit straight up. Some may find this position very comfortable. So with a fowler, the patient is seated straight up. Semi-fowler, they're leaning back. So now remember that medical terminology is the language of healthcare. It begins with root words, and then you add prefixes to the root words. You can add suffixes to the root words, and that's going to lend you clues as to if you know what the suffixes mean or you know what the prefixes mean. That can help you understand what the word means. And it's important for us to understand that, because as we do assessments of the patient's body, we want to be able to identify exactly where on the body that these problems are occurring, so that when we give a report, the person receiving the patient knows exactly what we're talking about. And if you have any questions concerning this one, I think what would work best for you, if you've not taken a medical terminology course, is that you look at perhaps a free online medical terminology course. Otherwise, many services. I know where I work in a hospital, we have a approved list of medical words that we can use, approved list of abbreviations that we can use, those sort of things. So just like anything else, the more you use these medical terms, the more comfortable you become with them. And I know that as doing these lectures, we'll use these terms over and over again as we start talking about specific body regions. We'll review both the anatomy and the physiology of those body regions. All right.